Hi, Namaste. Welcome back to Yoga Therapy with Madhu. I'm Madhu. In this channel, I talk about what yoga therapy is, how it can help you, some very big misconceptions currently in healthcare, and also yoga therapy tools that you can use in your daily life. In this video, I'm going to cover some of the tools that we did in 2025. So a recap video. If you want to see modifications like chair modifications, seated modifications, or detailed explanation of these poses, then I invite you to watch the playlist. I'll put it somewhere here or I'll put it in the description. And if you still have any questions, you can always put it in the comments. For the class, you will need a massage ball. If you don't have a massage ball, a tennis ball shall do. Or if you don't have any of these, you can skip this one. Apart from that, I also have a yoga blanket. If you don't have one, you can use a towel, dishcloth, or anything that you have. I also have a chair here. And the reason why I have a chair here is for support. If you don't have a chair, you can always use a wall, or if you don't want a support, that's all right. Without further delay, let's get started. So we're going to begin with some grounding. So lift your toes up and release them down. Lift your shoulders away from the ears and relax the spine. From here, we're going to softly close the eyes if that's okay. And just take a moment to notice what is happening in the body. You might even move a little from side to side, front and back. Simply observing the distribution of weight in the body. When we elongate the spine, we already see some relaxation and awareness in the body. From here, the next step is to engage that breath and awareness. We're going to start by some rounds of reverse breathing. Place your left hand on the chest and place the right hand on the left. From here, we'll inhale through the nose and exhale by counting 5 in reverse. Inhale, exhale, 5, 4, 3, 2, 1, release. Inhale, exhale, 5, 4, 3, 2, 1, release. Let's do that 2 more times. Inhale, exhale, 5, 4, 3, 2, 1, release. Last time, breathe in. Exhale, breathe out for 5, 4, 3, 2, and 1. Release the hands if they were on the chest. And take a few seconds to notice. Maybe your breath was faster before and it has slowed down. Maybe the shoulders feel a little more relaxed. Maybe not. Just observe without any judgment. When you're ready, if your eyes were closed, we can open them. Okay. Foot rolling. So for foot rolling, you're going to simply place the ball, maybe use the chair for initial support, and gently rock the leg or the toe front and back, massaging the foot. You can also go side to side, inside the toes. Usually I do this for about a minute, but this is a shorter video, so we'll go for about 10 to 15 seconds. Engaging the areas that feel sore. Good. And then when you feel ready, releasing. Again, taking a second to notice the difference between the leg that you massaged and the leg that you didn't. Now we'll go for the other side. So transferring the ball. Again, you can always use a chair or the wall for initial support. And you might notice that one leg is different from the other. Very natural. Asymmetry and symmetry is, part of life and body. So just about 10 more seconds. Remembering to breathe whenever it feels stressful. Okay. And then release. I'm going to put the ball to the side. Again, maybe lifting the shoulders, relaxing the body, lifting the toes, the heels. Okay. We're going to go for a balancing exercise, heel lifts. Okay. I have taught modifications for these. Again, you can always, subscribe. That way you will get the videos. You might be able to view the videos in your feed, or you can have a look at that playlist for help. So we're going to place our hands here and then gently lift the heels. So come onto your toes. Okay, so we're balancing the body. So if you shake, you lose the center of gravity. So it's important to hold. And then once you find your, balance, then you might release the hand if that feels okay. But there's no harm in holding a support. Okay. And then down. We're going to go for 5 more rounds. So 5. And 4. And 3. If you want to focus only on the heels, then you can sit down and do that, right? So we leave the balance out of it. Okay, 2 more. You might lift the hands up and down. And last time. Maybe hold, maybe, and then down. Good. And then just shake out the feet. The final standing exercise we're going to do is windmills. Okay, so you're going to widen your feet. Toes are pointed out or inward. Okay, and you're going to widen based on your height and your stance. From here, interlace the fingers and then gently rotate like a windmill. And then in the opposite direction. So I'm going to go opposite. And release. Excellent. Good. We're going to take a break to do some range of motion warm-ups. For somebody who has never done yoga before, I would advise to do these warm-ups just to get the body moving. Okay, so you haven't moved it in a long time. There might be a lot of stiffness. So even these gentle warm-ups can help to start relaxing the body. We're going to start with neck rotation. Okay, opposite direction. Good. We're going to go for side bend with shoulder rotation. Okay, So you're going to place your hands to the side. You're going to lift your right arm, come to the side. Okay. If this is too much, stay here. Don't come to, to the side. And then from here, rotating the shoulder. You can look up, you can look down, and you can look forward. Whichever makes your neck feel comfortable, kindly choose that option. Okay. And then switch direction. Again, if your range of motion is less, just twist. Small movements. Okay, then come back. Let's go for the other side. Always remembering to take breath in the middle. Because often we hold our breath. When we're focused or tense. So it's often good to pause and take a breath. Okay, we'll go for one more round. And release. Good job. We're going to go for wrist rotation. So bring your wrists in front and rotate. You can also do this if it feels too much. Close your fist as well. And then we'll go in the opposite direction. And release. Beautiful. Okay. Last we're going to do basket arms. So just rotating the joints. We're holding the opposite elbow with the opposite hand. Again, if you need to understand the pose better, I invite you to check out that playlist, okay? Because I have explained each exercise individually. Perfect. All right. Now we're going to come down to the floor and do some exercises on our hands and knees. I have shown a seated version of these, so check them out as well. So we're placing the blanket. And the reason why I usually put the blanket, I think I've mentioned before, is if you're somebody with knee issues, okay, and also you have done recent surgery, knee surgery a couple of years back, it's important to have some shock absorbent. Okay, so if you look at this, is also hardwood floors. So it's nice to have a shock absorbent. It's nice to have something that gives that cushion and padding to the knees. Okay, it's important to protect our bones and joints. Okay, we're going to come onto our hands and knees. You can also do this on your forearms if you have wrist issues. Okay, we're going to start off with Marjari Asana, cat and cow, or spinal waves. And it depends on where you're learning it from. All right. You're going to gently curve the spine, open the chest, look up. And then as you exhale, you're going to round the spine, round the back and look down. Inhale, look up. Exhale, down. Inhale. And exhale. Inhale. Good. And exhale. Inhale. And exhale. Last time. Breathe in, open the heart, open the chest, and release. Good. From here, we're going to go into Balasana. You can also do a modified Balasana, which I've shown in the individual video. So you're going to simply widen the knees or keep them together, depends on your hips. I'm going to widen a little. I'm going to gently push my hips back like this and then walk my hands like slowly, taking my time forward. If it's okay, placing the elbows and the forehead down. From here, take a few rounds of breath. And as you breathe, is there any way that you can relax a little bit? Just letting go. We'll stay here for a few more breaths. Maybe relaxing the shoulders a little more. And then when you feel like you're ready, you can come out of the position and sit down. Good. If seated is very uncomfortable for you and you don't sit a lot, because in yoga we sit cross-legged a lot. But if you're not sitting cross-legged a lot, then another solution is you might stretch your legs out, shake it up a little bit. You can even place a pillow or a bolster or cloth underneath. If you have back issues or spine issues, you can also support it with the wall. Okay. So we're going to go for a seated twist. Place the hands to the side. This is my right hand. Hello. Placing it on the left knee. Taking the left hand gently back. Now inhale, take a deep breath and twist towards the left side. Again, we want to twist till we are comfortable. At this point, if you're sort of out of breath, you're feeling uncomfortable, you're feeling dizzy, that means you've twisted a bit too much. Okay, so you will come out a little bit of the pose. I always invite you to listen to your body. And then release and slowly come back. Unfortunately, in YouTube videos or virtual videos, it's very difficult to gauge how much to push ourselves, how much to not push ourselves. So my idea or my understanding is always that I tell my clients, and my mentors have told me as well, is that we will use our body as a compass. So it's important to listen to your body. So if you can take a deep breath, maybe twist more. And if you start feeling that palpitation, you feel that discomfort, then it's okay to come back. Maybe today is not the day. Maybe today the body is feeling a little stiff. Okay, or maybe it's important to take it step by step rather than rushing it. Okay, let's go for the other side. So left hand on the right knee, right towards the side, and turn. Again, taking about 4 to 5 breaths here. Maybe noticing how the spine is, keeping the spine relaxed. Good, and then when you're ready, come back to the center. So we just have 2 more, movement meditation, and then we'll end with Brahmari. So movement meditation is a video. I got a lot of good response from a lot of people. Said that it helped them because it was a more realistic kind of meditation. In movement meditation, you are moving, and so there's no aspect of sitting still, because sometimes it can be overwhelming. Okay, so let's try it out. Bringing the hands in front of you, both the hands. Inhale. As you move the left hand to the side, you're going to look towards the left or right, which is going up, and then exhale, come back to the center. Inhale. Out to the other side, and then exhale back. Inhale side. Exhale front. Inhale side. And exhale front. As you can see, my eyes are tracking one hand. So choose any of the hands, and the eyes tracking the hands. As we move, fast round and center, and then and center and release. Good. As you can see, if you're focusing on eye and hand movement, the thoughts become more centered and more focused. So give it a try. The final one we're doing is Brahmari Pranayama or humming bee pranayam and meditation. Okay, this is very useful for people with brain surgery, stroke, insomnia, you name it. Okay, so Brahmari is the go-to. We are doing a modified version of it. Okay, we're going to start by placing the left hand on the chest and the right hand on the left. Okay, if it is comfortable for you, gently close the eyes and notice the body. From here, to perform Brahmari Pranayama, you will inhale through the nose and as you exhale, making a humming noise. Okay, so let's get started. Inhale. Again, inhale. Two more rounds. Inhale. Last time, breathe in. Release the hands. Take a few minutes to observe how you feel as to when you started. And then when you're ready, open your eyes. I hope you enjoyed this video, and if it was helpful to you and you know somebody who it can help, please feel free to share. And also, if you want to see more videos, because we will be having more videos in the coming year, so you can subscribe so you'll be the first one to know about it. Of course, if some of these exercises were not very easy to do, for example, you have arthritis or you have any kind of stiffness or frozen shoulder, then this might be a little intense. So in that case, it's important to get, personalized help. And I would love to help if that's something that you are interested in. So you can go to my website, drop a message or, book a free call and we can take it from there. So you don't have to suffer alone. And usually in these conditions, there is a way around it and it takes time. But it's also nice to have somebody who's supporting you while you are figuring it out. So take care. Hope to see you and hope we practice again. All right. Bye-bye. Om Tat Sat.